Dr. Michelle Fingeret is a licensed psychologist who has worked for over 18 years in the oncology setting with a unique focus on addressing body image issues for patients with cancer. She obtained her Ph.D. in clinical psychology from Texas A&M University in 2004 and completed her postdoctoral research fellowship at MD Anderson Cancer Center. While at MD Anderson, Dr. Fingeret developed the only program of its kind in the United States, focusing on addressing body image issues for cancer patients through a combination of research, patient care services, and educational activities. Her body image research and therapy program garnered national media attention and enhanced the care of cancer survivors struggling with changes to their appearance and bodily functioning. Ladies and gentlemen, please welcome Dr. Michelle Fingeret.
Hi, everyone. I'm pleased to be here. Hoping to see my slide set come up so I can... There we go. Okay, great. Let me go back here. All right, so I'm so thrilled to be here today. I'm here to talk about managing body image concerns after surgery. Here's the outline of my talk I'm going to give today. I'm going to try to keep myself on time here. I'd like to offer a definition of body image because I think it's really important for everybody to be on the same page. This is a very complex and multidimensional concept, and I want to have a good working definition of it. So I'll always start my presentations by offering a definition of body image. And then my goals are to help identify some basics of body image assessment and treatment that can be beneficial for both cancer survivors and healthcare providers to be aware of. And then hopefully today you're going to leave with some practical strategies for managing body image concerns. Those are my goals for today. So first we talk about what is body image. And it's important to understand that body image is it's not just referring to physical appearance or how you feel about the way you look or what you see when you look in the mirror. Although physical appearance is a really important component of body image, it is not the only component. If you think about it much more broadly, body image encompasses perceptions, thoughts, and feelings about the entire body and its functioning. So that means it's not just about the way you look, but also about the way your body functions and the way you feel, bodily sensations, all of those things. What's really, really important to understand, though, is that body image is completely subjective. It is only about how you, the individual, feel and experience your body. And this is really important to understand in an oncology context because there can often be a disconnect between the way an individual feels about his or her own body and the way somebody else sees it. The healthcare team, your friends, your loved ones, your family members, people telling you how good you look or how well that's the big one, how good you look. And if you don't feel that way, it's really important for us to be able to understand it from the perspective of the patient themselves. And that's the biggest trick for a healthcare provider is to really understand that subjective perception. So we're going to talk a lot about that today. And then also understanding that body image can change over time. It's completely fluid, and there's so many factors that can affect the way you're experiencing your body. And of course, when you throw kind of cancer into that mix, it really makes this much more complex.
Body image is a critical issue for people facing cancer. Cancer and its treatment can change a person's physical appearance and the way the body functions. Some of these changes are temporary. Others can be long-lasting. They can come about gradually, but sometimes they happen all at once, such as when someone has surgery. Having concerns about body image during and after treatment is normal. Men and women with all types of cancer may have trouble coping with changes to their appearance and body. Many patients are reluctant to talk about their body image concerns with both their loved ones and members of their healthcare team. They may feel guilt or shame about having body image concerns and do not want to burden others with these issues. Most cancer patients admit they feel embarrassed or concerned about changes to their bodies at some point during their cancer journey. Some of the more common concerns relate to hair loss, scarring or disfigurement, swelling, loss of a body part, or functional changes to speaking, swallowing, seeing, walking, or hearing. Body image also relates to sexuality and intimacy. Dealing with body image is a very personal issue. Learning to cope with body image can be difficult, but is not impossible.
So I think that's the end of the video. And that was something that I actually created when I worked at MD Anderson as a way to provide some education on an important topic and a good synopsis and overview. So there's a lot of things that were in there that I'm going to expand upon as I talk to you today. It's really important to understand this is like the way that I view things. All cancer survivors have to undergo a process of body image adaptation. It's obviously different for everybody because the body changes as a result of cancer. The experience of your body changes. And so with that, it's important to know with those range of responses that some people adapt better than others, but it's different at different time points. The way one adapts to these body image changes that result from cancer and its treatment, they're not based on the location or the extent of the cancer. They're not based on whether it's visible or not visible, the changes that you're going through. There's so many factors that can affect how somebody reacts to these changes. And that's why we kind of come back to the subjective nature of body image. I've often seen patients who have very similar types of cancers and locations and extent of illness, and their experiences of body image can be completely different. Body image concerns can arise prior to, during, or after treatment. I do work with a lot of people who have anticipatory anxiety, particularly around surgery, and was the kind of headline of this talk was about surgery. So we are going to speak about that. But just because you don't have body image concerns prior to treatment, or maybe even at the beginning of treatment, that does not mean that they cannot arise later. And so that's a really important thing for healthcare providers to understand. And that kind of goes to that earlier point that body image can change over time, body image concerns. And really at the heart of all this, and I may say this many, many times today, body image concerns are completely normal and to be expected as part of cancer treatment. I've often told people I work with that you are more abnormal if you're not having concerns about these body changes. They don't have to be major concerns. They could be minor or relatively minor concerns compared to other things you're worried about, but it is extremely normal and to be expected that you're going to have concerns about the changes that you are going through or you will go through in the future. So here I want to kind of go through this. I'm going to take a little bit of time on the slide because I want people to understand that this is really knowing that body image concerns exist on a continuum. So if we focus on the middle of the slide here and understanding that what is an average or normal response to body image changes as a result of cancer, it's to have mild or moderate difficulties adjusting to the changes. What does that look like? You may experience intrusive thoughts about body image concerns, unwanted thoughts, unpleasant thoughts that are bothersome to you. You're likely to feel somewhat self-conscious in social situations. That's normal and to be expected. And you will experience difficulties at times coping with these body changes. But what sets people apart in this particular grouping is that you have mostly realistic expectations, and you might not be limiting or curtailing your daily activities due to your body image concerns. However, they can still be quite distressing, and you can still benefit from brief supportive therapy. So I work with a lot of people who are kind of in this place. Now, the people who have more extreme concerns, it's because we understand that these body image concerns are significantly interfering with their daily functioning. The preoccupation with intrusive thoughts about body image discomfort can be for many hours a day and in many different situations. And you may engage in social isolation or avoidance due to these body image concerns. So you're not getting out there and doing things that you enjoy doing. I give an example of that of patients who may, not want to get into a bathing suit, which, by the way, is normal kind of anyway for women to maybe not want to get into a bathing suit. But if it's because of the body image changes and the body image concerns, and it's interfering with your ability to enjoy going to the pool with your children or your grandchildren, we should talk about that. Like that's an issue that should come up and can be helped kind of managing the concerns around that if it's interfering with those types of activities. And you may have broader psychosocial difficulties, including clinical levels of depression or anxiety, in very extreme cases, suicidal ideation. And at the heart of this, a lot of these individuals may have very unrealistic expectations about their cosmetic and or functional outcomes. And so in this type of a thing, I often tell my patients, if you have very extreme body image concerns that are interfering with your life, the fact that you have these concerns is actually normal. The concerns themselves are on an extreme end. And so that's a really important way to frame things. Now, going over to the other end of the extreme here are people who say, I don't have body image concerns. Maybe they're adapting well. Maybe they view their scars in kind of more of a badge of honor way. And they could be adapting well. Maybe they don't have a lot of investment in their appearance or their body to begin with. But unfortunately, I do think there's a large number of people in this category who are just minimizing concerns that they have because they feel guilty or ashamed. They don't feel comfortable bringing this up with loved ones or healthcare providers. A common theme I hear is, I should just be happy I'm surviving. This is something I shouldn't be worried about. And we have to understand that normalizing and validating these concerns is really, really important. So I'm going to move on to my next section here, and I'm just checking my time. The basics of body image assessment. I like to talk with people about how to approach conversations about body image. And this is a framework that I came up with for healthcare providers that I work with, thinking about boiling it down to the 3 C's. So the 3 C's are common concerns and consequences. And at the base of the triangle is, when I walk into a room or I first am talking with individuals who may be struggling with body image changes, I say, hey, by the way, I just need you to know it's really common. Let's take breast cancer as an example. It is very common for breast cancer survivors to have concerns about body image changes. This is a normal thing and to be expected. So you kind of lay the framework. Then it's, what, if any, concerns are you having about your body image or body image changes to your appearance, changes to functioning, hair loss, weight changes? You can delve into that. And then, of course, the next part is, and then how is this affecting your life? What are the consequences to social functioning, work or occupational functioning, romantic relationships? From this type of a framework, I was able to ascertain a patient who had a head and neck cancer that they had not gone to work in 4 months and they hadn't left the house. They didn't tell the doctor they were having these concerns. Unfortunately, in that scenario, the healthcare team, when the patient came in, immediately talked with them about how great they looked. And it just kind of shut down that conversation. So really, this is the basis with which we want to be approaching conversations in order to normalize, validate, and get the information. So taking it one step further is really, if you were going to either, as a healthcare provider, want to evaluate if you kind of had a suspicion that a patient was maybe struggling with body image changes, or if you're the patient who's struggling and you want to find a way to talk to your healthcare team or your loved ones about what you're going through, here's some things to think about, to understand and to frame, okay, how would I evaluate how I'm doing with all of this? First thing I do as a clinician is I want to understand, I'm actually going to go all the way down to the second to last bullet point here. It should be at the top. The importance or meaning of the body part that's affected. Okay, that's a really important thing to understand especially if you think about any breasts or any other type of body part that can have a lot of meaning for a patient. What is that meaning and importance and value to them? But I want to ask questions like, tell me about the body parts that are being affected and describe how your body has changed. And I listen very carefully for the language that is used. And I'll get to that in a minute about what I do as a clinician to help with that. I want to know, were these body changes expected or unexpected? And what concerns do you have about what might happen in the future? So surgery, as an example, going into surgery, what concerns are you having? Or it could have to do with radiation, chemo, other types of treatments. Are you having difficulties with viewing the body part? We're going to talk a lot about that. How much are you thinking about these changes? How much distress is it causing you? Are you avoiding activities? What kinds of activities are you avoiding? Are you avoiding grooming, or are you engaging in a lot of excessive grooming or camouflaging? How much time is that taking? And then are you having concerns about sexuality and intimacy? So this is obviously a pretty comprehensive list. And as a healthcare provider, I know in the routine clinical exam, you're not going to get to all of these, but this is a framework that you can use to think about how to talk with patients. To the heart of the matter now, let's talk about treatment and some treatment strategies and maybe some tips that can help. We're going to spend the majority of the rest of the presentation on this. So I break this down into 3 categories, and there's more categories than this, but I'm going to present it to you in this way today. First is facilitating treatment decisions related to body image. How do I help people with that? Coping with recent body image changes. So there's going to be a lot there, especially on managing concerns after surgery, because that's obviously a very acute change. You go to sleep and you wake up and something has changed. Obviously, there's also gradual changes to body image as well. And then promoting body image acceptance more in the long term. Okay. So here's some basic things that I work on with people when they're in it doesn't even have to be in the beginning of their treatment journey. For a lot of patients, there's treatment decisions that have to be made all along the way. This is a long process. It's not a single time point. And sometimes we circle back to this, the next big treatment decision that has to be made. It could be about a revision surgery. It could be about a new type of treatment if you're starting chemo, radiation, so on and so forth. So first and foremost, it's normalizing and validating the body image concerns, okay? At every step along the way, I find that people need to be reminded it's okay to have these concerns. It's okay to still have these concerns. It's okay these concerns are you're having now, you didn't have them before. It's okay these concerns are getting worse, better. They got better, now they're getting worse, all along, okay? Promoting autonomy and choice is a really important thing. As long as people are well informed, they need to be able to make independent decisions. And those decisions can be based on body image or affected by body image. I'll talk a little bit about goals and values clarification, and then ways to help set some realistic and flexible expectations for outcome. It's a hard conversation that I have with people, but usually going into surgery, my main point is you don't have a crystal ball. I can't tell you exactly what you're going to look like or what's going to happen. Whatever you're picturing in your mind is probably not what's going to happen. It's either going to be better or worse. And if it's better than what you're picturing, maybe you're going through a lot of extra angst over something that might not happen. And if it's worse, then maybe your expectations aren't realistic to begin with, and we need to just be flexible. And so this is a conversation I have over and over and over with people. So here's some fundamental considerations. I don't need to go through the first bullet point because I've said it, but I'm putting it up on the screen for emphasis. It's really important to have a safe space to explore your treatment options. Hopefully, healthcare providers can provide that safe space, but you can also think about this with family and loved ones. Being able to talk with people about your values related to body image and cancer care, and being able to balance that, right? People who are hesitant about agreeing to a certain treatment option because they're worried about how it's going to affect their body. We could talk a little bit about the values you have for like your life and what quality of life versus these body image concerns. But sometimes it's just about being able to explore that in a safe space where somebody's not going to tell you what to do or be judgmental or any of that, or try to fix it for you. So it's really important. I had the luxury when I was working at MD Anderson for all that time to be able to circle back to the treatment team and provide information to them, because a lot of times some of this information is not being shared with the healthcare team, either because you don't want to bother them, it's not coming up, there's so many other things that you have to deal with. But having that conduit and being able to make sure the treatment team knows what your concerns are, those are the people that can help educate you about the outcomes and what to expect. And then let's talk a little bit about managing uncertainty related to treatment outcomes. That's probably one of the hardest things I have to do with people because I don't know. I mean, I'm not a medical doctor. I don't have knowledge in that way, and I really steer clear of that. So it really doesn't affect the work that I do, what the actual outcomes are expected to be. It's more about managing that uncertainty. And so some tips for that are really helping you understand that hope and fear can coexist, knowing that it's okay to be fearful and have hope and be able to have those sit together. I talk a lot about managing counterproductive strategies, right? Your uncertainty around treatment outcomes. Are you engaging in a lot of internet searching? Are you ruminating a lot about possible outcomes? Are you engaging in a lot of reassurance seeking? These are things that can be helpful to a degree, some internet searching, some thinking through outcomes, some reassurance seeking, but it can get to a point where it's very counterproductive. So I talk with people a lot about different approaches to managing uncertainty, a lot about being able to just kind of accept the lack of control that you have and try to relinquish that control. You can't control, the situation, but if you acknowledge what's worrying you and you allow those worries and fears to be with you and not try to control them, sometimes it's about making room for them. I talk with patients about having a bench and letting the worries sit alongside you, recognizing those thoughts and feelings and not trying so hard to push them away. At the same time, there is room for some healthy distractions. So it's about balancing that. I think that being out in nature, walking, stretching, calling a friend to get some social support or engaging in a hobby are also important things. So it's a package, right? All of these things work together. Next slide is on coping with recent body image changes. I'm going to talk a lot about this thing I refer to as gradual exposure, systematic desensitization to mirror viewing. That's a lot of fancy psychology terms, and maybe some of you are familiar with that, but I'm going to break down what that means. I will spend some time on this because the topic of the presentation is managing body image concerns related to surgery. This is a big one. Also, problem solving around social situations, and then the importance of mind-body relaxation for this whole process. So here's something that I do a lot with people I work with. In an ideal world, I would sit down with someone before they have surgery and go through tips for mirror viewing. And it can be as easy as giving a self-help handout that kind of goes through each of these strategies, or it could be something where you work with a psychologist or you work with a therapist to help you after the surgery to go through these things one by one. A lot of times I'm not seeing people before surgery. I'm getting them after surgery when they're kind of freaked out about what happened, the outcomes and how to deal with it. And that's okay. We can still do some of this stuff then. But, one of the big tip-offs is, are you having trouble viewing the surgical site? Is it something you're actively avoiding? And I have had people who have been really good at avoiding for weeks or months looking at a surgical site. And it becomes very challenging at that point because the longer you avoid something you're scared of, you reinforce that fear. So my kind of first tip here is don't delay. And I talk to people all the time. As soon as you are able to view the way something has changed on your body, the surgical site, the better. Now, there can be medical reasons. Obviously, there's bandages covering it. So some of this has to be understood within the confines of your medical care. But as soon as you can take a peek at it, you should. And here's why. Obviously, it does the whole fear avoidance cycle is something that you're able to avert if you start taking the steps more immediately. But more importantly, I try to explain to people, and a lot of you will know this, there is a dramatic amount of healing that takes place in the early stages of recovering from surgery. If you don't understand what it looked like at the very beginning, you can't appreciate how much it has improved. So even for people who are very fearful and don't want to look right away, I sometimes tell them, get somebody else to take a picture of it and you can look at it later to really get a sense of the comparison and contrast of how much it's healing. And it also gives you a sense, when we talk about kind of the being able to control things, you can control when and how you look. So taking this kind of this gradual desensitization is a process that some people need to go through. It's gradual exposure, and systematic desensitization. So if you're not able to really look, or let's say you have looked, but then you start avoiding because you don't want to deal with it anymore. One thing I've done with people is encourage them to use their sense of touch. There's different ways that you can experience the body image change. It doesn't only have to be visual, okay? For people in the hospital, sometimes what I have done is I have gone in and given them a description of what it looks like if they've been avoiding looking. And I do it in a very deliberate way. It's neutral, objective language. So I want you to imagine this is what I tell people all the time. If I'm going to describe something to you of how it looks, I'm going to imagine that you don't have the gift of sight. So if I say something like, it looks, there's a, if somebody says something like, the scar is ugly looking, a blind person does not know what ugly looking is. That's not a fair description. A fair description would be the color or the size or the length of the scar or however it looked. So whenever somebody else is giving you a description, it needs to be neutral and objective language if you have a trusted person that can do that. I also talk with people about starting slowly. You don't have to look at things all at once. You can look at just a piece of it. Truth be told, once a lot of people start just taking to look at a piece of it, then they're ready to just look at the whole thing. But it's a way to give yourself permission that you don't have to look at the whole thing at once. Sometimes I encourage people to take a picture of it and look at the picture if you're not able to look at yourself. I also talk with people about dimming the lights. Turn the lights off and don't look at it in that kind of harsh, especially in the hospital, those lights can be very harsh. All throughout this, I would say a good place to start is to get yourself in more of a relaxed place or a relaxed space. There's lots of ways you can do this through deep breathing or meditation or sensory, like a mental image of going to a place in your mind that makes you feel very relaxed and calm and comfortable. I used to offer these little handheld mirrors that I would give to patients in the hospital. Think about like a little cosmetic mirror that would go in your purse and that you can use that instead of using a full length mirror, right? Just that, so you can look at a piece of whatever it is. And then of course, a big part of this is just being compassionate with yourself as you're going through this, not judging yourself for the way you're feeling or how you're coping. So moving on, I do a lot of work with people on what I refer to as mindful mirror viewing. I will have them verbalize and process their reactions to how they initially felt when they viewed themselves in the mirror, or they just viewed themselves, and how this reaction evolves over time. I listen very carefully for biased, judgmental, and emotional descriptions, and I call people out on it. I call people out when they tell me that their breasts look like Frankenboobs, I think was something somebody told me once. They talk about their hideous and ugly scars or how deformed they are. And that language is not helpful and is harmful. And there has to be ways to be able to adjust and think about objective, neutral language to describe your body and your appearance. Some of the techniques that I use with people and patients come from this body image workbook, an 8-step program for learning to like your looks. It's not a book specifically for cancer patients, but there's a lot of really great stuff in there that it is designed to be a self-help book, but I utilize a lot of that in my work. So next we talk about problem-solving social situations. And, big part of going out into the world after you had some gradual or acute body image changes from cancer is checking in with yourself how much mind reading and fortune telling you're doing, okay? So if you think you know what somebody else is thinking or the first thing they're going to notice or everybody's going to notice this, that's mind reading. And I tell people all the time, you don't know what people are thinking. And then the other part is fortune telling. Well, I know if I go into that situation, then this is going to happen, or somebody's going to say this, and again, it's really important for you to check yourself to stay more in the present moment and look at what's happening now and recognize that some of these thought patterns can really hold you back. Now, I'm not suggesting that in a 40-minute presentation, we're going to change everybody's thought patterns, but a first step is just being aware of these things. Are you engaging in mind reading and fortune telling? And I often tell people as they're getting back into being in social situations, of course, it's normal to be self-conscious and to be worried about how people are going to react. One strategy that is important is to use your nonverbal communication strategies. It makes a big difference if you're kind of slumped down and trying to hide certain parts of your body versus sitting straight up, using your good posture, using your eye contact, smiling, nodding. The adage, fake it till you make it, is real. I use it all the time with people. And I say, this makes you feel more confident than maybe you are. And it helps you look more confident. And it's a first step. If you're really having a hard time thinking about what to say or which again, you should be prepared for some comments and questions. But if you focus on the nonverbal parts, then that's a really big step for you. And I talk with people all the time about dealing with these well-meaning comments about appearance. I kind of addressed it a little bit earlier on with healthcare providers. Sometimes you walk into the exam room and they'll tell you how great you look, and that really can shut people down from being able to express their body image concerns. But with family and friends, I had a patient who I use this story all the time, and I think it's great. She was having a really hard time with comments about her appearance and how great she looked. And so she felt safe talking to her close friends and family and said, that really bothers me when people say that. I would rather have you tell me how I'm so happy to see you. It's so great you're here. And she had to continuously work to kind of retrain people that was much more welcoming to her than them commenting on her appearance. I think she found it very empowering, and I love that story. I think it's a great story. So I don't really have time to go into how to do mind-body relaxation. What I would do is encourage those of you, though, to understand that it is an important part of being able to connect with your body and being able to stay present. And, there's lots of ways that you can do it. This is something that I work on a lot in therapy with patients. So these are just some of those techniques. If you know how to do the deep breathing, you can do that anywhere. It really can be helpful, calling to mind mental images of places where you've been that make you feel safe and comfortable. So these are all things that can be very, very helpful. So this last part is really talking a little bit more about promoting body image acceptance. And I think about this more long-term. I think about this as kind of the maintenance phase of we've gotten through dealing with treatment decisions. We've helped cope with some recent body image changes. So now what? Because this body image acceptance is really, and I'm going to kind of talk about that at the very end of what is body image acceptance and how do we get there? These are some of the ways that we're going to get there is through some of these techniques. The mindfulness, the cognitive flexibility, and the body esteem activities. So a real simple definition of mindfulness is being able to observe your experiences without judgment and staying connected to the present moment. So all of that mind reading and that fortune telling, okay, I'm going to try to move my stuff here. Sorry. Thank you. Just need a little readjustment. So observing your experiences without judgment and really being able to know that where you are in the moment is what's real and what's happening, and not, kind of getting out of your head of going off into what's happening in the future or what's happened in the past. So I talk a lot about listening to the language that people are using. And, okay, wait, I'm so sorry. I'm just going to move this out just a little bit. Thanks for being a little patient with me, guys. It's important to understand some of these body image assumptions. This is what I really listen for, basic beliefs held about body and appearance. Let me give you some examples of some body image assumptions that I hear a lot and I work with people on. Here's one. The first thing people notice about me is what's wrong with my appearance, or what's different about my appearance, or what's changed about my appearance. Okay. This is an assumption that a lot of people come in with. That's kind of that mind reading and then the fortune telling of what's going to happen next. And I talk with people a lot about how to challenge this body image assumption. So people may or may not notice things that have changed about your appearance. Some people are actually more observant than others, as you may know in life. And you also know that body image and being concerned about the way you look is not something that is just specific to cancer patients, right? Or cancer survivors. There's plenty of people out there in the world that have their own body image issues, and they're worried you're going to notice something about them at the same time that you're worried somebody's going to notice something about you. So we talk a lot about how to kind of challenge this. And also, even if somebody does notice something that's changed about your appearance, your behavior and your actions can oftentimes override that. That's not the narrative. You can change the narrative on that. Another example of a body image assumption. I must always do whatever I can to look my best. There are some people who really strongly live by that motto, right? They always want to look their best. Well, okay, that's okay that that's how you want to approach life, but it has some issues. So the always part is a problem, right? Because always and never are words that I really work on with people a lot, that we need to not stay focused on something always being a certain way. And the must, I must always do whatever I can to live my best. Who says? Where's that coming from, right? Sometimes we have to look at that. So here's another one. It is impossible for me to be satisfied with my looks. I will never measure up to society's ideals. Well, maybe that's true. What are society's ideals? And never is a strong word. And society's ideals change over time. There's not one ideal that everybody aspires to. Is it impossible for you to be satisfied with your looks? Well, maybe it's going to be very challenging. Maybe there's times you're more satisfied than others. Maybe there's ways you can do things to be more satisfied with your looks that don't involve, plastic surgery. I'm talking about things that you have more control over internally. So we challenge these things. That's where I refer to a lot of these as being maladaptive, and how can we utilize reframing and cognitive restructuring to promote greater cognitive flexibility. So this is important, and this is something that you all can do. Everybody can do it. I don't care whether you're a cancer survivor or you're a healthcare provider on this call. How can we help you value your body more and have more comfort and confidence in your body? It's thinking about body esteem. And what are the pillars of body esteem? They're appearance enhancing activities. So I talk a lot with people about wearing clothing that feels comfortable and confident, that makes the clothing is comfortable, the material, the fit, the size, the color, something about the color, any way that you can enhance your appearance. And I think about it like staging a house, right? Maximize your assets, minimize your flaws. Those types of activities can be very important to help you gain a little bit more comfort with your body. Sensory pleasing activities. You have 5 senses. You can look at things that are pleasing sounds, pleasing materials, and think about activating your senses and doing different ways to connect with your body. And then health and fitness activities. They don't need to be rigorous exercise. It can be stretching. It can be walking. It can be, different ways that you can enhance health and fitness activities. And a big part of this is planning activities, right? Getting out your calendar and planning how many different activities you want to do in these different categories. I work a lot with patients on that. So my last slide is or my second to last slide is on what is body image acceptance. And I'm going to spend the last few minutes talking about this. So it is not about liking your body. It is not about learning to love your body or thinking positively about your body. That's not what body image acceptance is, at least not in my book. It's about recognizing your thoughts and feelings about your body, where you can identify and understand all these beliefs that you have that might contribute to some of the challenges you face, right? The body image distress you might experience. And it's also about identifying things about your body you like, things about your body you don't like, things about your body maybe don't really care about so much, and holding all of that together, holding the positive, negative, neutral emotions related to your body, and allowing yourself to experience all of these thoughts and emotions without judgment. That is a lot easier said than done. I can put a little bullet point on a slide and say, okay, that's what we're aiming for. That is not easy, right? And it's a process. Some days you're going to be better at it than others. But if you can find compassion for yourself as you come to terms with how you feel about your body, that's a large part of the battle. Stopping all that judgmental, negative thoughts that you have and just having more compassion, allowing those negative judgmental thoughts to be there, but without judging them. Okay. So for a lot of people, this does require, some supportive therapy and work. It's not necessarily something, depending on where you are with this, you can achieve alone, but some people can. So there's a wide range of how you can go about this. So I'm going to offer my conclusions before we go into a question and A about just understanding the following. Body image is very multidimensional and it's complex. It's not just about your appearance. It's also about body functioning, sensory experiences related to your body and the like. It's normal for cancer survivors to have concerns about body image. In fact, it's more normal to have those concerns. And I've done a lot of research in this area, right? When I say it's normal, it means more than 50% are having concerns about body image. I wish I had some of the figures up with me right now. All I know is it is very normal and expected. Body image assessment and treatment strategies are available. They are very underutilized. A lot of healthcare professionals need better education and comfort level with addressing body issues. It's part of my mission in life. My niche in my specialty area, everything I do is around body image care for cancer patients. And I'm very dedicated to trying to help teach healthcare professionals how to do better at this. But I also think that survivors need to be assertive in asking for psychosocial care to meet their needs on this important issue. So I'm going to leave it at that and find out what's next in terms of this Q&A portion.
Thank you so much. Thank you so much, Dr. Michelle Fingeret, for your presentation. It was insightful, informative. We appreciate you presenting for us. We're going to move into the Q&A portion. Feel free to go ahead and if you have any questions you'd like to ask, go ahead and put it into the little Slido module next to the presentation. I will start with one question that came in. It says, great info, thank you. Any suggestions for service or care providers to offer a different framing when a client says things like frankenboobs or et cetera, when they've sort of expressed the discomfort with their body image?
So what was the first part of the question? It was about a service or can you repeat that
yes,
first part?
So it's, oops. Oh, I have my cam. Are you unable to see me? Okay. What it said was, any suggestions for service or care providers to offer a different framing when a client says things like frankenboobs?
Well, I think, again, it's about kind of pointing out that that's a very judgmental and emotional language. It's very descriptive. And what I would say is when they're saying that, you pick up on the fact, wow, you sound really distressed about these body image changes, or it sounds like this is hard for you, you're having some trouble coping, or you feel negatively about your body. That's what that statement means. And so sometimes it's just getting away from the language. So if you're a provider in care, I don't expect you to do cognitive behavioral therapy like on the spot with a patient, but I would just shift the focus of the conversation away from that language towards, wow, the emotion, get at like the distress and how is this affecting your life? You can go back to that. Oh, it's really common to have concerns about body image changes. It's, how is this affecting your life, right? Get at the distress and acknowledge the deep distress the patient may be in. And sometimes, by the way, they say it as a joke, right? They're like, oh yeah, frankenboob. The minute some of those self-deprecating jokes come out, though, sometimes that's a way that they're kind of covering over the distress. And so I think sometimes calling it out and maybe also asking, is this something that maybe you could use somebody to talk to about, is a way to shift the focus and the energy in the room.
Okay, thank you. So another question is, if I'm having body image concerns and they are arising later, who do I contact? Like, what would be my first step in seeking help?
I think there's a lot of different ways, none of which are going to be 100% straightforward and easy. But part of it is if there's any way to alert your healthcare team and ask them for resources, or find a therapist in your community that's either a master's level or PhD level therapist. There's a lot of professional societies that might be able to help direct you. So I know that Cancer care sometimes may have some resources. There might be some nonprofits for the particular type of cancer that you have that offer either peer support or support groups. So that's another place you can go. Looking for a mental health provider in your community through your general practitioner, or going on seeing who's on your insurance and being able to look that way. Asking family and friends if they have any mental health providers that they use, getting a good referral from a friend. And then you need to screen that provider to make sure that they can help either work with cancer patients or body image. Those are some of the suggestions that I'd offer.
Great, thank you. Last question. Do you find that body image concerns can play into decision-making about like surgical procedures? Let's say you're diagnosed with breast cancer and you are anticipating body image concerns. And if that happens, what can be done? What are things that can be done to help a client in that case?
Well, I'd think about this in two different scenarios. One scenario is whether you're going to accept treatment, period, right? If there's a treatment recommendation that's being offered, like a mastectomy or hormonal therapy, or there's something where you're either saying yes or no, and you're saying yes or no you're saying no based on body image concerns. That's a very different scenario than something like a reconstructive surgery where you may have options, and you may then having to weigh which option, like you want to do reconstruction, but you don't know which type. So in the first scenario, it's about really dealing with your fears of why are you so worried about what's going to happen? Are you really worried about weight gain? Are you really worried about scarring? And what are the ramifications if you decline treatment? That's important to be able to really talk through, like I said, with a safe person, a safe provider. With the reconstruction, right, there's lots of different ways to do it depending on what you're eligible for. And that requires you to have a skilled team that you feel comfortable and confident with. If you don't feel comfortable and confident with the medical advice you're being given, then it's important to seek another opinion, a second opinion. So very much you can see that. And I think I tend to see the more extreme cases because I was a psychologist working in a medical center, right? I would get the very extreme cases of the patient who basically said, I don't want to have any surgery at all. And obviously the treatment team was very concerned about that. And how do you work with the patient to manage their fears? Because their goal was they wanted to get treatment. They were just very scared. And that did require, I think, a more intensive level of an intervention to help a patient work through that.
All right, we have one more minute left, but I think we have one last question. Any suggestions on how to respond to care providers who focus on body changes as weight gain versus exploring this conversation?
If I'm understanding the question, it really has to do with being able to talk with your healthcare providers about your concerns about weight gain without potentially having, this is based on my own experiences, so I'm reading into this, them kind of poo-pooing that and not wanting to address that with you or talk about that with you, that's just the side effect and you might have to deal with it. I don't know if that's the actual question, but I can tell you that I've dealt with that a lot as a provider, that maybe there isn't as much sensitivity around how distressing that is for people to be facing a treatment that is potentially and likely going to cause weight gain. And I do think that we need to educate healthcare providers on how to be more sensitive about those conversations. And again, sometimes it is on the survivor to be the assertive one to say, hey, hold on a minute. Can we please have this conversation? I'm comfortable with where we are with this. I'm struggling with this. I need help with this. I don't think that the healthcare providers are always going to be at the forefront of thinking through the psychosocial ramifications because they're focused on the medical aspect, and that's where that's the lane that they're in, right? I'm in the psychosocial lane, so I'm going to sit and really work with the patient on that. You're going to have to figure out ways to get your needs met in this way. And it could also involve having to go outside of your treatment center could be a trusted friend, could be a support group, could be a mental health provider. There's a lot of ways to go about it, but don't ignore it, because it's not going to go away. If that's something that's meaningful and important, which it is, by the way, to most people, okay? That's an issue. That's a real issue. And it's okay to have that issue. So I think I have to just kind of end it at that.
So thank you very much, Dr. Fingeret, and thank you all for attending this presentation. So the next presentations are going to be updates in the treatment of metastatic breast cancer with Dr. Linda Sapira. We have updates in the treatment of ovarian cancer with Dr. Amir Karam, and updates in the treatment of early stage breast cancer with Dr. Fazia Riaz. So thank you again. Take care. Bye.